This is the reason that organisations like Access to Medicines exist. The objectives of our group are simple. They're to ensure that medicines are affordable and that research and development is directed towards public health gain globally. So, what do? In addition to our annual conference, we hold a number of public education meetings throughout the year. We engage with social and print media opportunistically, and this year we spent a lot of time engaging with the political establishment. Earlier this year, we were invited by Dr. Harkin to launch our policy brief in Leinster House, and subsequently by the Joint Oireachtas Health Committee to make a submission on the National Medicine Strategy. We had meetings with about 40 TDs and senators, and we were struck by their empathy and concern for the constituents unable to access medicines. We also noted their frustration at the powerlessness to negotiate prices, but on the other hand, concerned that any Irish challenge in the current model might result in withdrawal or partial withdrawal by industry. But overall, I must say, we felt that our approach was very much welcomed. I would like to remind you of some of the struggles regarding access to new medicines in Ireland in recent years, and I will use some of the newspaper headlines to do so. May 2017 sees the conclusion of a campaign to persuade the HSE to reimburse Orkambi, with a successful outcome for cystic fibrosis patients and of course for the manufacturer Vertex. 2 months later, we learned that the HSE had to suspend its hepatitis C eradication programme halfway throughout the year as it used up its 30 million annual budget. The Farmers' Journal highlights the dilemma of another group of patients with a rare form of emphysema who sought unsuccessfully to persuade the HSE to reimburse Respreza. In August, we read that the HSE refused to reimburse Translarna, a drug used to treat children with muscular dystrophy. A few weeks later, we read that the manufacturer of Translarna sued the HSE because they refused to reimburse their product. Fast forward to this February, when we've got a good headline. There's fantastic news for this little boy and his family as the HSE announced that it had finally approved reimbursement of Translarna. But a week later, we see another group of patients protesting outside Leinster House, desperate to seek access to Spinraza, a drug used to treat spinal muscular atrophy. And the same week, the Sunday Business Post tells us that the HSE has almost exhausted its 2019 funding for new drugs. 2 days ago, we read that for the first time ever, certain cancer drugs which are not available in the public sector will be funded on private insurance policies. According to some Irish cancer specialists, these drugs have, and I quote, excellent rock-solid evidence for their use. We know that view has been challenged by a number of other oncologists. So how did we get to where we are? In 2015, the then Minister for Health, Leah Varadkar, blamed high prices on the greed of drug companies. In the aftermath of our conference last year, an Irish Times editorial quoted the keynote speaker, Ellen Tahone, declaring that governments were being held hostage by the pharmaceutical industry. Less than 3 weeks ago, our President, Michael D. Higgins, while commenting upon EU economic policy, said, "We must challenge the assumption that there is no area of life in which the optimum circumstance could not be provided from the marketplace." Nobel laureate Sir John Sulston put it a different way when he said, "We have to recognise that the free market, as good a servant as it is a bad master. We cannot take important global decisions on the basis of the free market alone." It was not always thus. Pre-1995, medicines were only loosely subject to patent legislation. Insulin and penicillin were discovered and produced without any patent in the 1920s. In 1955, Jonas Salk discovered the polio vaccine, and I would like to show you a clip of his famous interview with Edward Murrow when he was asked if he would patent the vaccine.
Who owns the patent on this vaccine?
Well, the people, I would say. There is no patent. This is... Could you patent the sun?
So you can see we've been using and developing drugs for years without reference to patents. It's a relatively recent thing we've been doing. So we believe that the R&D model is not fit for purpose and requires radical reform. You might ask, where will we get the extra money for reform? The answer is we don't need any extra money. Ireland already spends 2.3 billion annually on drugs, and globally the spend is €1 trillion. Governments simply need to become drivers of the model rather than behave as passive consumers. So, I mean, I suppose this is to say we're not really a way out group. Who else advocates for reform? A recent Dutch report quotes former ministers Lilian Ploumen and Edith Schippers as saying, "We cannot achieve any real progress without acknowledging that the current patent-based business model needs to change. The system is broken." This editorial in the BMJ concluded that governments have power to actively shape and create markets and not just remain on the sidelines. This UN high-level panel on access to medicines published a comprehensive report in 2016 which supports most of the calls we've heard today for reform. And the authors of this report, which include Mariana Mazzucato of UCL, Ellen Tahome and Gerard MacDonald, who presented this morning, conclude in October 2018, as the number of countries struggling to afford new medicines grows, the question for political leaders and policymakers is not whether they should initiate reform, but when they should initiate reform. This is my final slide, I think, and I would like to conclude with some specific recommendations to the Irish Government. We'd like to call upon the Irish Government to support the Italian resolution for transparency at the World Health Assembly next month. We would like the Government to ensure that conditions are attached to public investment in research and development to ensure that public health gain is an outcome, because governments already invest heavily in drugs research with limited return in terms of public health gain. We would call upon the Government to support intergovernment collaboration initiatives such as Beneluxa, as it is evident that cooperation between governments is essential to successfully negotiate with global pharma and to introduce reform. We must not be afraid to explore the use of TRIPS flexibilities such as compulsory licensing, which are there to protect public health against unreasonably high prices. Finally, governments need to direct monies so that they can commission drugs for the future rather than be reliant on the private sector and the free market to produce drugs. To summarise, we call upon the Irish Government to introduce and support the necessary reforms to ensure that we are not holding even more desperate conversations in 10 years' time. Thank you. My name is Kieran Harkin. I'm one of the founding members of Access to Medicines Ireland. I'm a GP. I work in a regular practice in inner city Dublin, and I work in a primary care centre for homeless people, again in inner city Dublin. I think Dermot summed it up for me when he said we need a generic patient advocacy group that is funded independently, as opposed to one trick or one line patient groups looking for one particular drug or looking for one particular disease, because invariably there ends up being conflict between different patient groups. I think forums are really important to have doctors and patients and academics and researchers together in the one room, learning from each other is hugely beneficial. It's quite a complex area, and you need to have all the stakeholders in the room to come up with to identify what the problem is in the first place, and then to come up with some reasonable solutions for those problems. I think we have a good way to go to institute reforms. I think it's a really important step. I think it was really important. We know from recent events that we really do have a problem, and we know that it's just not sustainable, and we cannot continue to hope that by agreeing to pharma demands for more money and more money and more money and even more money, that the problem will eventually go away. That's just actually making the problem worse. And I think there were very few people in the room that actually believed that by simply agreeing to pharma's latest demands for whatever price they were looking for was going to be a solution. But I think there's a significant step to be taken before we implement reform and before we make a change. I think that's That's the big problem. It reminds me a little bit of the frog being slowly immersed in cool water that's slowly boiled up. And I think we've been slowly boiled up close to boiling point, but it's almost too difficult to get out. We're too squeezed, as opposed to a frog who's just dumped into boiling water, just pops out. The key reform is recognising that a monopoly, granting a monopoly to somebody who discovers a life-saving drug for 20 years where they can charge whatever they want, that has to go. That's number one. And number two is, that needs to be replaced by something else. And the something else is probably lots of money, because that's what drug companies have. They no longer do fantastic research. They simply buy up research. So we need to do the same, and governments need to come together and fund research and take ownership of the product and use it for public health gain rather than shareholder profit.